Med history. Ascariasis is a helminthic disease, the etiological agents of which are roundworms, ascariids, that parasitize in the human small intestine. The early phase of ascariasis occurs with symptoms of general malaise, fever, skin rash, hepatosplenomegaly, lymphadenitis, dry cough. In the chronic phase, the symptoms of gastrointestinal tract damage come to the fore: decreased appetite, nausea, diarrhea, abdominal pain. In order to detect ascariasis, serological reactions and fecal examination of helminth eggs are carried out. Ascariasis is treated with anthelmintic drugs, Vermox, Decaris, Pirantel. Additionally, antihistamines, enzyme preparations, and probiotics are prescribed. Reasons. The causative agent of lung ascariasis is a representative of the nematode family human Ascaris in the larval stage of development. An adult individual parasitizes in the small intestine exclusively of a human, which becomes a source of invasion. Ascaris are bisexual. Females are almost twice as large as males and can reach 40 centimeters in length, laying up to 250,000 fertilized and unfertilized eggs daily. With the feces of the diseased eggs fall into the soil, only fertilized eggs pose an epidemiological danger. With sufficient temperature, humidity, and soil aeration, larvae mature in them. Ingestion of such eggs causes ascariasis. Under unfavorable conditions, the development of larvae is suspended, but their viability inside the eggs is maintained for a long time. Helminths stay in the intestine for a year. Then, in the absence of repeated invasion, self-healing occurs. The risk factors for the development of the disease are meteorological and climatic conditions. In some regions with a hot, humid climate, ascariasis is detected in 95–98% of the population during mass screening. Helminth larvae in such climatic zones mature throughout the calendar year, whereas in temperate climates, human infection with ascariids occurs from April to October. In hot, dry regions, the incidence of helminthiasis is significantly lower. Ascariasis does not occur in permafrost conditions, unsanitary conditions. The spread of worm infestation is facilitated by crowding of the population, lack of running water and sewerage, and lack of water. Ascariasis often develops as a result of eating unwashed vegetables and berries grown using uninfected human feces as fertilizer. Children's age. Helminthiasis in children of preschool and primary school age is 1.5 times more common than in adults. Young children taste objects, put dirty fingers in their mouths, have a lot of contact with pets, play in the sandbox, not observing hygiene rules due to age characteristics. Professional activity. People who are forced to constantly come into contact with the soil are more susceptible to the disease. Ascariasis is found in field breeders, agronomists, and other employees of agricultural enterprises. Among urban residents, employees of landscaping services, vegetable stores, and bases are more likely to get sick. Symptoms of ascariasis. The clinical symptoms of ascariasis are diverse and depend on the massiveness of the invasion, the age of the patients, and the phase of the disease. Allergic, infectious, and toxic, hepatic and pulmonary syndrome may develop during the migration phase of larvae. This stage of ascariasis in children is often asymptomatic. Allergic manifestations are characterized by vesicular or articular rashes on the trunk, hands or feet, severe itching. Infectious and toxic syndrome in ascariasis is accompanied by febrile fever, weakness, malaise, sweating, lymphadenopathy. Signs of liver syndrome may include an enlargement of the liver and spleen, moderate soreness in the right hypochondrium, increased rectal tract during this period. There is a decrease in appetite, nausea in the morning, vomiting, abdominal pain, diarrhea, constipation, bloating, weight loss. Toxic effects on the nervous system can be manifested by weakness, sleep disorders, memory loss. In children, delayed psychomotor development, phenomena of meningism, epileptiform seizures. Massive helminthic invasion can cause complications. For example, during the migration of ascariids into the bile and pancreatic ducts, mechanical jaundice, purulent cholangitis, multiple liver abscesses, acute pancreatitis, appendicitis, peritonitis can develop. It is possible to develop mechanical obstruction of the respiratory tract by helminths, leading to acute ascariasis asphyxia. In children, ascariasis is most often aggravated by intestinal obstruction. Ascariasis in pregnant women contributes to severe toxicosis, delayed fetal development, complicated course of labor, and the postpartum period. Pathogenesis. Helminth eggs enter the human body by fecal-oral route with contaminated food and water. The disease begins with an acute migration phase. The larva leaves the egg and attaches to the inner wall of the small intestine with hook-like appendages. Through the mouth opening, it perforates the mucous membrane and penetrates into the intestinal veins. With the blood flow through the portal and inferior vena cava, the helminth migrates to the right parts of the heart, then to the pulmonary arteries, capillaries, alveoli, bronchioles. Larvae develop in the respiratory tract within 20-21 days. Parasitizing in the lungs, helminths block small vessels. The nutrition of the pulmonary parenchyma is disrupted. Microinfarcts of the alveolar tissue are formed. Ascarid waste products have a powerful sensitizing effect on the human body. An inflammatory reaction develops. An infiltrate is formed around the helminth, consisting of lymphocytes, eosinophils, plasma cells, and sometimes histiocytes. Subsequently, such infiltrates either completely resolve or areas of fibrosis form in their place. Sensitization of the body by ascarid metabolites often leads to bronchial obstruction. With coughing jerks, nematode larvae are thrown into the pharynx, swallowed, and re-enter the small intestine. The disease passes into the chronic intestinal stage. Symptoms of lung ascariasis. The first clinical signs of lung lesion with ascariids appear on the 7th-10th day of the helminthic invasion. The symptoms of the disease are diverse. The patient is concerned about a paroxysmal cough with scant separation of light sputum. Occasionally, hemoptysis occurs. Eosinophilic pneumonia is accompanied by subfebrile fever. Sometimes, more often in childhood, body temperature rises above 38 degrees C. This form of helminthiasis of the lungs is characterized by the wrong type of fever. When the temperature rises, chills are detected. Other symptoms of intoxication are also expressed: general weakness, headache, decreased appetite, unstable mood, intense pain in the right or left half of the chest, which increases with deep breathing, coughing, sneezing, and movement, indicates the development of pleurisy. Later, mixed dyspnea is added, the severity of which depends on the amount of exudate in the pleural cavity. The toxic allergic effect of ascarid metabolites provokes bronchospasm. The patient is disturbed by attacks of suffocation with difficulty exhaling, accompanied by a dry cough and whistling in the chest. Along with pulmonary symptoms, urticarian skin rashes and hepatosplenomegaly are often present. Sometimes ascariasis of the lungs is hidden. Diagnostics. To suspect the presence of ascariasis in a child or an adult, complaints of unexplained and persistent fever, cough, skin rashes, digestive disorders, weight loss, nervousness allow. Detection of antibodies in the blood serum using immunoenzyme analysis and latex agglutination reaction helps to recognize a helminthic invasion in the early phase. Changes in the general blood count are characterized by eosinophilia, increased ESR, small leukocytosis, anemia. During lung radiography in patients with bronchopulmonary syndrome, the so-called volatile Leffler infiltrates are detected, foci of infiltration that change their position along with the migrating larva. Microscopic examination of sputum may reveal ascarid larvae. In the chronic phase, the main method of diagnosing ascariasis is the examination of feces for helminth eggs. However, in this way, it is possible to detect an invasion only 3 months after infection. Given the likelihood of parasitization of only males, as well as immature females or old individuals, helminth eggs may be absent in the feces. In this case, diagnostic deworming is performed. During radiography of the small intestine against the background of a contrasting mass, ascaris can be seen in the form of light ribbons or tangles located in the lumen of the intestine. In the early phase, ascariasis must be distinguished from pneumonia, tuberculosis, and lung cancer. In the chronic phase, differential diagnosis is primarily required for duodenitis, enteritis, cholecystitis, and other diseases of the digestive system. Treatment of lung ascariasis. Pulmonary ascariasis is an early stage of helminthic invasion and lends itself well to conservative therapy. At the same time, many experts in the field of parasitology and infectology believe that anthelmintic drugs are more effective in the intestinal phase of the disease. In addition, the toxic effect of the decay products of larvae during their mass death can cause severe pulmonitis. Treatment with antiparasitic agents is carried out in several, 2-3 stages. During the larval migration stage, thiabendazole, mebendazole, or albendazole can be prescribed. Of great importance at this stage is the relief of pathological conditions. Antihistamines, corticosteroids, bronchodilators are used. After 10-14 days, the course of anthelmintic therapy is repeated. The treatment of ascariasis is carried out under the supervision of an infectious disease specialist. a pediatric infectious disease specialist or pediatrician, and consists of organizational and routine measures, deworming, dispensary supervision, and prevention of reinfection. The general recommendations relate mainly to following a diet with a high content of vitamins, animal proteins, and limited carbohydrates. Drug therapy is carried out with anthelmintic drugs, of which thiabenzole or mebendazole are prescribed in the early phase of ascariasis, and levomazole, Pyrantel, etc., are prescribed in the intestinal phase. To reduce allergization simultaneously with anthelmintic drugs, a short course of antihistamines is recommended. Enzymes, pancreatin, are used to normalize digestive function. Correction of the intestinal microflora is carried out with the help of probiotic drugs. The effectiveness of anthelmintic therapy is monitored 3 times 2 weeks and 1 month after the course of treatment. A patient who has had Ascariasis is monitored for a period of 3 years with an annual coproscopy. The prognosis with adequate treatment is favorable. Ascariasis of the lungs is usually completely cured. With repeated invasions, for example, people living in endemic foci gradually develop immunity to this helminthiasis. There is no specific prevention of Ascariasis. To avoid invasion, it is necessary to observe the rules of personal hygiene. Do not use water from open reservoirs for drinking and cooking. Do not eat unwashed vegetables, fruits, greens. Public prevention includes the construction of sewage treatment plants, the safe fertilization of agricultural land against parasites, and mass preventive deworming of the population of regions disadvantaged by Ascariasis.